Hi, it's Dr. Janowski. For Sonata, we're going to do a lip today, and there's many different ways to do a lip, and you've probably seen a lot of videos on lips, but I'll show you the way I do it, which I think is a nice way to do it because it's really easy for the patient. We get a lot of control. So I take my fill and I put in these small insulin syringes, and this really gives me a lot of control rather than the needle that comes with the product, which is thicker and longer. So we want a short needle, and we want a thin one. This is a 31 gauge, and it gives us a lot of control. We can make micro droplets, and despite the fact that we're putting small aliquots in, it does smooth out. It doesn't end up with a bumpy result. So I'll show you how we do that. And remember, the lip has 3 tubercles on top and 2 on the bottom, so we want to emphasize those. And she already has a nice lip with good border definition, good shape, so we really just need to focus on the volume. We don't need to put anything in the border. That tends to look overdone unless someone has a very poor border. So if you want to use your buzzy, you can. We give patients this little buzzy machine, but we've already put some numbing cream on. In 5 minutes it's very numb. And what I like to do is use some tapping techniques and push the tissue onto the needle rather than the other way around. So if we just get that needle in very quickly and we place small amounts in those tubercles, and we can inject slowly like this. The patient's not going to feel very much. Just a little drop as it goes in, but it's usually quite tolerable, and we're just adding some volume there. It's a little more tender up at the GK point, that point there, and this point here, but an important point to do for definition. Good. And we're just going to massage with our fingers here a little bit. Good, she's doing terrific. And then we'll go out to the sides. Excellent. There's usual minimal bruising and bleeding with this technique, despite there's a lot of folks. And we can get lots of control. We can bring that out to the edge of the upper lip. And then we want to do the lower lip, and I will pinch the tubercle, come from underneath, and that allows me to really accentuate the tubercle. And then we can massage it, but she has a nice natural one there, and so we're just going to emphasize those. That's the most important part. And a good taper at the sides is important. We don't want to fill the outer edge of the lower lip too much. That looks unnatural, because there is a natural taper to it. So once again, we're just going to reinforce what we've already done here and look for any asymmetries. She's doing great. We're using here Restylane Lift, and you can use almost any product in the lip. Give her nice volume and some structure. So again, just small amounts, and we just again check for symmetries. Each time we go, we get a lot of control this way. And even with a firm product like this, it will smooth out very nicely. It may take a day or two to completely smooth out, but works very well. Good. Okay, so we treated the lip there. We used 1 syringe of Restylane Lip. Most patients do well with 1 syringe. Some patients may need to come back for more. Typically, even if they need more, I'll only do 1 at a time. And sometimes I'll only do a half a syringe and let it settle, because it always comes down. And then complete the treatment in 2 sessions. So that's another common technique to avoid a lot of swelling or over-treatment. And you can see it's a natural look. It's slightly over-treated, but we know it's going to come down. And how is that in terms of pain?
Easy.
Yeah, it was easy, yeah. So we want a painless, positive experience for the patient. and as little recovery as possible. So no ice. I tell people don't ice the lip because it can make it swell. You can use arnica and just leave it alone. Lipstick is fine afterwards. And it's typically will last anywhere between 6 and 9 months depending on the patient. So that's a lip treatment.